Namaskar viewers, hello and welcome to Sansad TV. I am Tina Jha, you are watching Perspective. In the run-up to the Union Budget 2026-27, we are focusing on key sectors that not only drive India's economic growth and momentum, but also directly touch the everyday lives and well-being of citizens. Today our focus is on the healthcare sector, a sector that has seen visible and meaningful transformation in recent years. From strengthening health infrastructure and expanding health insurance coverage to pushing digital health initiatives, medical education and indigenous manufacturing, the government has taken several decisive steps to build a more resilient healthcare ecosystem. Yet, with India's vast population and a rising burden of both communicable and non-communicable diseases, significant challenges remain. As India now moves a step closer to its Viksit Bharat vision, the Union Budget 2026-27 is being seen as a critical opportunity to shift from incremental progress to systemic strengthening of the healthcare ecosystem. So what should be the government's key priorities for this sector? Where should investments be directed to deliver maximum impact? Also, how can policy, innovation and private participation come together to ensure affordable, accessible and quality healthcare for all? To discuss these critical questions and more on pre-budget expectations from the healthcare sector, I'm joined by a distinguished panel of experts. I'm pleased to have on the program Ms. Preeti Soodhan, former Union Health Secretary. Ma'am, thank you for your time. Welcome to the program. We're also joined by Dr. Ashish Chaudhary, Director and Head, Akash Hospital, Dr. Vineet Malhotra, Urologist and Director and Founder, VNA Hospital. Gentlemen, thank you so much for joining in. Welcome to the program. So let's begin by asking the most obvious question as we head into the Union Budget 2026-27. What are the top expectations from the healthcare sector? Where do you think the upcoming budget can perhaps make the most meaningful change to what has already been done? Ma'am, let's begin with your perspective.
So, Tina, as you set the stage for today's program, we are aiming for Viksit Bharat. And for Viksit Bharat, a precondition is healthy India. And for healthy India, what do we need to do? I think that's where the budget needs to emphasize on. So, in my view, India can be healthy if there is adequate and balanced emphasis on preventive and promotive care, on infrastructure development, on aligning and partnering with private sector, on ensuring access to not only affordable healthcare but also quality healthcare, and also keeping in sync with the latest developments in artificial intelligence and technology.
There are multiple areas on which work has already been done, like I rightly said, in terms of strengthening the infrastructure, in terms of manufacturing. There is visible transformation. Dr. Malhotra, let me come to you. How do you assess the progress made so far? What according to you has worked well on the ground, given the significant measures that have been taken in recent years? But most importantly, how do you expect to add momentum to the progress that has already been made?
Thank you so much. And I think one of the positives that I've seen in the past years has been the dissemination of healthcare. And I think there is an active effort by the government to ensure that we are reaching the rural healthcare systems. That's priority, because if you look at it, we have a vast majority of healthcare needs in the rural areas. Having said that, there is a lot yet to be achieved, and I think we should see and expect significant changes in the insurance framework of our country, because that's one of the differences that we've had in healthcare here, and I guess one of the shortcomings of our system, which does not meet that middle consumer or middle citizen of the country. That's the very, very large spectrum of middle class that cannot afford tertiary healthcare and will not use government healthcare for their services.
Dr. Chaudhary, how do you look at the progress that has been made so far? But going forward, what should be the focus areas to ensure that whatever reforms have taken place, they are more durable, they are more long-lasting, and most importantly, they cater to the systemic improvements, to cater to the vast population, to cater to some of the newer diseases that we are seeing, which our population is also now struggling with?
So, if we, take it from the previous speaker, there are so many steps which have been done in decentralizing the healthcare, bringing, healthcare to the tier 2 and 3 cities. Implementation of Aayushman Bharat. Of course, there are challenges in such a vast country. Few important aspects which can be, a point of contention in this budget could be the PPP mode, which government is seriously looking at in many states. They have already implemented. Delhi NCR, I have seen even at the center, after the government had a similar, footprint in Delhi government, state government, there has been an impetus on bringing private players on board with a lot of accountability, so that the onus of treating majority of underserved, underprivileged patient, is shared by the private players, which are, of course, doing a lot of efficiency work. Technology is another area where I feel in tier 2 and 3 cities, which are underserved, and we can't expect super specialists, all of them, to go and settle down in tier 2 and 3. So technology can play a vast role. Tele-ICU, telemedicine has already shown significant strides in COVID times. And I'm sure with a proper implementation, with a lot of startup ecosystem developing in India, there's going to be, a big boost for the tier 2 and 3 cities. Third part, which I feel is significantly important, apart from the firefighting mode of treating the disease, is the preventive care. Post-COVID, a lot of people have resorted to preventive health space. Startups are coming and promoting, preventive healthcare. In fact, there is a new term which has come up big way in Western world, which is called lifestyle medicine, which focuses not on the, the treatment part. They focus on social connection. They focus on sleeping time and so many other basic things, the physical activity and all. So I think, time has come where we have to focus not just on the treatment of diseases, but also to cut down the burden, also to reduce the new onset of chronic diseases like diabetes and stroke and other things. We have to focus on going back to basics, going back to our ancestral way of living, where technology should help, but it should not become a overwhelming aspect of our daily life. And in that way, we can actually not only improve the access to the patients, to the communities, but also reduce the disease burden by bringing in information, education on preventive space, wellness, and lifestyle modifications.
That's true. It's something that has to become a part of our lifestyle. In fact, there are several healthcare leaders who have heard from them talk about the future of Indian healthcare lies not just in treating illnesses, but in detecting them early, in terms of strengthening domestic capability, also building trust-driven, patient-centric systems. Ms. Preeti Sudan, I'll come back to you to understand, given that you've had such a vast experience as Union Health Secretary, what measures do you think are needed now to reflect this kind of shift, to ensure that a related question that I asked Dr. Chaudhary, we are able to institutionalize these reforms that we've been able to carry out so far, so that they have maximum impact and they are more durable in nature?
So I think Dr. Ashish very rightly put forth that health education, I would say health and wellness education, is very important. If you will recall, when we started our health and wellness centers, Aayushman Bharat Arogya Mandirs, we also started school health and wellness program. So we have to start from families, we have to start from schools, we have to teach our children that wellness is important, being healthy is important. So, emphasis on nutrition, emphasis on yoga, emphasis on, say, cutting out fast foods. That's one aspect. Next is, you spoke very rightly about detection. So in our health and wellness centers, we are, as you know, screening for 5 NCDs. Hypertension, diabetes, and 3 cancers: cervical, breast cancer, and oral cancer, right? So the referral pathways have been defined, but they need to be monitored. That's important. So we have taken these steps, but I find that over the states there is not uniformity in application of what is expected to be done. Number one. Number two, that there are actually 12 packages that these Arogya Mandirs need to implement, but not all states are implementing them. Then I'd also like to emphasize on mental health, right? So again, Dr. Chaudhary very, I think, pointed out that how the Western world is looking into, social cohesion, trying to say that all that is actually saying that one should socialize to overcome loneliness. Thankfully, we have our family system, but still now it's going nuclear. So therefore, we need to actually use technology. And I must say that hats off to our telemedicine initiatives that were possible across India during COVID. So e-Sanjeevani is now very well institutionalized, and we have also in mental health we have initiatives that are tying up the whole of India. So we need to take that further. And also, if you will recall, that we were able to bring everyone on all the states, people, everyone to observe the guidelines of COVID. How were we able to do that? That was through, social media, through our top leaders speaking about it, through Honorable Prime Minister, talking about it. We observed that Bharat Bandh on 22nd of March. I think we need Gram Sabhas, maybe all over the country after post-budget, to speak about the need for preventive and promotive healthcare, and enlightening people about it. I think that will help.
That's right. Awareness is the key to staying healthy and early detection as well. But Dr. Malhotra, we have a large population. We already spoke about it earlier. That's a huge challenge. But there is also a challenge of rising burden of diseases that we have not even heard about. Plus, post-pandemic, there are certain problems that people face about which there is not enough awareness. How can we bridge these gaps, and especially in areas that are still struggling with affordability, with access, with finances? So where do you think the government can perhaps now step in? Our dream is to make our country a Viksit Bharat, and as ma'am rightly pointed out, that cannot happen until it's a healthy India. And therefore, it's important that with awareness, we're able to bridge those gaps that still persist within the system.
So I somehow believe that word, that Viksit Bharat is Shikshit Bharat, which means that when we have education and when we increase that education, we are going to bring in our thought and dream of Viksit Bharat. So at somewhere we've got to look at this as what the government is already actually doing, which is the increase in the, not only in the number of seats and medical seats that we're seeing across the country. We've had a huge effort towards increasing the number of not only seats in general medical seats, but also in institutes such as AIIMS, which are now spread across the country. We're also seeing a lot of effort towards making sure that you are then disseminating more and more of these seats and these doctors to rural healthcare networks. What we need to do, or probably the government needs to look at, is how do you incentivize these doctors, these specialists, so that they're more interested and inclined to go into these areas where we don't have education and healthcare as such, and then we are able to percolate the awareness, the preventive protocols, and everything very early. I think, as ma'am has said, Preeti ma'am has already said, we've seen school education and programs change enormously in the last decade, and that's going to be a huge help, because not only the fact that COVID led to a lot of diseases, we've seen how air pollution has affected health and lifestyle in the last few years. And education starting at school level will let people know how we can manage, how we can contribute towards reducing or contributing towards the air pollution level. So I think education at primary level, increasing the education at the postgraduate and graduate levels, increasing the number of medical seats, incentivizing these specialists then to go to rural networks. I think all of that will contribute to one, increasing awareness, and then providing appropriate newer information, preventive and treatment alternatives. Again, obviously with telemedicine, that is really, really helpful. We know how e-Sanjeevani has worked. We know how post-COVID things have changed in terms of the digital mission of the government, and that's contributed a lot to how healthcare is now being provided to rural areas.
That's right. Simultaneous efforts have been going on in recent years, and especially the trust that we've seen in terms of providing access, making healthcare more affordable, and most importantly, providing quality healthcare. We've seen improvements on all of those aspects. We've already spoken about it. But Dr. Chaudhary, human resources is something that remains a concern. Dr. Malhotra did share his thoughts on it. But how do you think, or what kind of policy or fiscal incentives do you think will plug those gaps, especially in addressing the regional imbalances that we're talking about in underserved aspirational districts, like the government puts it?
So, if you talk about human resources, I think there is no dearth of young talent in India. The only thing is that as the skill development has, catch up big time with the government initiative, where even the organization who are training people coming from rural background in their premises on one or the other skill. If it specifically talk about healthcare, we also employ so many people who come from very poor backgrounds. They learn the nuances of various functions in the hospital and a healthcare facility, whether it is support services, administrative or clinical. And thereafter, 1 year down the line, they are able to get into the mainstream healthcare delivery. And that's how, otherwise without these efforts from the government, nobody from rural background will ever get a chance to work in a metro or a bigger hospital or healthcare, and then they can go back and contribute big way in their own cities. If we talk about talents, in the super specialty space or the doctor space, primary and secondary care, finding a clinical talent even in tier 2 and 3 is possible. Definitely, there is always a challenge to find, super specialist availability in the underserved areas. But yeah, I strongly feel that the initial model of PHC, CHC, and district hospital, and then going for a tertiary care facility as initially envisioned by government in all programs, I think somewhere if we try and build the strength along with participation from private players, even in that sector, we can very well, and with the skill development in place, all the secondary level care can be managed very well at the periphery. And yes, wherever there is a referral required, but that has to be streamlined, because right now, somebody who requires a critical intervention, they are left on their own. The attendants, they don't know where to go, where they will get that timely intervention, whether it's a cardiac heart disease or a stroke happening. The time is brain, time is heart. So there are some critical areas, and even the trauma, where although National Highways Authority has done significantly in maintaining the safety of people traveling on various highways. But yes, lot to be done in terms of accident victims as well as the emergencies which come out of these areas, and they have to be ferried to the right hospital, the nearest hospital. And in that sense, we are able to provide the therapeutic or a intervention just in the golden hour or the right frame of time. But yeah, skill development across the board has helped, significantly in bringing the talent in the local area, in the tier 3 or tier 4 cities. And I'm sure, similar developments coming from the government, where even the person who is getting trained, even the organization who is training, they are incentivized in one way or the other. I think overall, the real participation of government institutions and the leadership, along with the private players, already doing good job. I think that can bring in, ease out a lot of burden on the government machinery, and they can focus on more, strategic decisions for furtherance of, equitable healthcare across all the strata of the society.
That's right. It requires a coordinated effort. There are various concerns, challenges that we've already spoken about, but a coordinated approach is what will perhaps address them effectively. Coming to Aayushman Bharat, Ma'am Preeti Sudan, the question here is, Aayushman Bharat has been a game changer, we all know. In recent years, it has had tremendous impact in terms of access, in terms of the expanded coverage nationwide. But of late, we've been seeing concerns surfacing around package rates, around the reluctance of hospitals when it comes to participation in this program. How do you think these concerns can be addressed effectively so that everybody who is party to this scheme, which we know has had tremendous impact, is not the one compromising at any level or impacting the quality of service for that matter as well?
So I feel, Tina, that the package rates need to be realistic. They need to be looked into and revised as per, the prevailing rates. Number one. Number two, that if you remember the last year's budget, I think more than 9,000 crores was the allocation under Aayushman Bharat, if I'm not mistaken, if my memory is right. So there is no lack of provision of budget. However, all the private hospitals also need to be on board. So I would suggest a periodic dialogue, to understand what are their constraints. Because we can't say that they are not taking in patients and all that. Let's try to understand their constraints. And as you know, that health is a state subject, so it can be done state-wise. It's not that everybody has to come to Government of India to do that. But it would be a good idea to have a dialogue to understand what are the reasons. Sometimes I feel it's not just the financial part. There could be other constraints also. So let's try and understand. Maybe the packages need to be redefined, not only in terms of financial terms, but also in terms of because we also include what are the interventions required. So a dialogue, I think, will resolve the issue.
That's right. As we wrap up the conversation, I'll focus on technology, the role of technology in the healthcare sector, how it has strengthened the system in terms of access and making things faster. Dr. Malhotra, to you first. We've made significant progress, much to be happy about, on digital health platforms through both public and private partnership. But what role do you think the upcoming budget playing in scaling the digital health records, in AI-based diagnostics, that will be crucial, and also in areas of telemedicine? It has had significant positive impact in terms of saving time, in terms of people they're aware of the disease, but they're hesitant in going to the clinic. But these are aspects which have been introduced and which have made things quite easier for all of us.
Thank you. Yeah, I think so. COVID changed technology, this thing for everyone, and enormously for healthcare. And we know how that started, right from the vaccination drive that happened with COVID, the fact that you could have an app which could tell you the status. I mean, things changed so profoundly with our learnings from COVID. The fact that we could have these kind of meetings where we could get onto a platform and discuss. And from there, this has really taken off. And it's taken off in both forms. I mean, whether it's education and awareness, whether it's the fact that you can now disseminate information a lot easier on a digital platform, get a lot more viewership on a digital platform, and have people actually listen, understand, and then follow what's being said. But also that now you're able to use this technology even one step further. That means implementation, diagnostic tools, whether you're going to have a variety of diagnostic tools that will be used for your impending epidemics in the form of diabetes and hypertension and obesity, metabolic syndrome that we are witnessing now in the country, or whether you're going to see them in terms of implementation of surgical procedures, robotic surgeries, telesurgeries, telemedicine, and you have experienced surgeons sitting in their in the metro cities and operating patients with surgeons at the less trained or lower trained surgeons who are at tier 2 or tier 3 centers or rural centers, where surgeries, complex natures of surgeries can be performed with the help of telemedicine. So a lot, and we have so many tools. I mean, we've seen the access of devices which allow you to actually mentor someone through a surgical procedure so easily by just wearing some glasses, which allow him to then understand and have the mentee actually teach the mentor teach the mentee the procedure so that it can be safely performed. So yes, all right from the diagnostic aspect to the education, awareness and preventive aspect to implementation and actual performing of surgery, all of this is going to change profoundly. And I think the government is taking steps towards them. A lot more needs to be invested. We need to see that kind of investment into healthcare overall, which means the spend of percentage of GDP needs to increase, and we need to make sure that appropriate investment into the future for digital healthcare is done as proposed.
That's right, because if we want a healthy India, it will require a much more stronger and targeted policy push, but at the same time, participation from all stakeholders, especially in context of the public-private partnership to enable that we're able to strengthen the sector and ensure that the vision of healthy India becomes a reality. Time allows us to take up only that much on the program. Thank you so much to all our guests for joining in, sharing your thoughts, your views with us and our viewers. To you viewers, thank you very much for your time as well.
To watch more programs of Sansad TV, subscribe to our YouTube channel and don't forget to like and share them.